out. Breathe out. Yep, breathe out. It's okay.
Sorry.
Breathe out. Keep breathing through this.
You got it, you got it.
Ooh. So guys, we're currently walking to get me dilated because I'm only 1 centimeter, and yeah.
What's up, everybody? So right now we're just waiting on Destiny. We're gonna check her cervix, how dilated it is. Hopefully it's done. We just came back from walking an hour, and it's crowded in here. But yeah, hopefully she's good to go, because been here since 2 a.m. It's already 4, right?
Yeah.
4. So, and the pain's crazy, right?
Yeah.
So might have to get some morphine for her, but no. I know. Am I on focus?
I don't know.
We'll find out later.
Hey lovelies, welcome back to my channel. For those who don't know me, hi, my name is Destiny, and if you haven't already, don't forget to hit that subscribe button down below. And in today's video, I'm going to be doing a story time / vlog with my boyfriend Alex.
Hello.
So yeah, let's get right into it because it's hectic.
So it all started Friday morning at 12 a.m., right? What happened?
2 o'clock.
At 2 a.m.? At 2 a.m. at Friday morning. What happened?
Okay, so basically what had happened was around 2 o'clock in the morning on Friday, I was on the verge of sleeping, and I just started realizing that I was itching myself, and then like all over my body just got uncontrollably itchy. It felt like little bugs were crawling everywhere, like on my hands, on my feet, my legs, my back. My face was itchy. It was like to the point where I couldn't sleep, and you can literally see my scratch marks on my body. So I woke Alex up, and he said to call telehealth. And so I called them and explained to the nurse what happened, like what I was feeling. And she basically said that she thinks I have a condition called
Cholestasis?
Cholestasis, and like we'll put like the description of what it means somewhere here. So
but basically what it is, it's a very dangerous condition where it can lead to stillbirth, right? So it's nothing to play around with.
Yes. So and I also Googled it, and a lot of females said they had it, and it's like the absolute worst. So that was the first thing I actually did, because before I even called telehealth, and before I even woke up Alex, I Googled like the itching at 39 weeks, and a lot of females wrote that this is the condition, and to take it seriously, to call or talk to your doctor as soon as possible. So then that's what led me to call telehealth or whatever. So yeah, she said because it was 2:30 or 2 o'clock, 2:30 in the morning, she said to call my OBG right away when the office opens, so that way I can go take a blood test to see if I have it. So then I called my OBG, and then
Called her at 9:30 to make an appointment, but she wasn't available. Your OBG, right?
no, she had this week was, what is it?
It's a Jewish holiday, Hanukkah, right? So she wasn't available already, so she sent us to another associate of hers. I don't know. I was his replacement.
Yeah, so the nurse said, well, the reception said she's not available, so I told her, okay, what am I supposed to do? So the reception put me to an on-call nurse, and then that nurse said that she wants to speak to a doctor to like see whether I should go to the actual office to get the blood work done, or if I should go to the hospital. So she'd call me back, which took her a whole hour to call me back. So I'm here like, oh, what the hell, like what am I supposed to do? What are we supposed to do? But anyway, she called me back. She said that the doctor said I should go to the hospital, so we did.
Yeah, she got some blood work done. So the blood work to test for the cholestasis takes 5 days. So we're like a week. It takes a week. Yeah. So they only tested it for other stuff in her blood, and everything came back, but you can't know about the cholestasis for a week. So her OBGYN and their new doctor talked on the phone, and they're like, your full term, it's better to not risk it. So, and we actually think you really do have it because you're itching uncontrollably. So let's induce you and make the baby come right away, so that you don't stay long with this condition, and it risks for potential stillbirth.
Yes. So once we got that call, we were home, and she said, like, you should go to the hospital, get induced or whatever. So we went to the hospital. We explained to them the whole situation. Well, actually, she actually called them herself and told them, like, this is what's going on. So we got to the hospital. They hooked me up to the monitor. The doctor that was covering for my OBG, he came in, introduced himself, and explained what the whole condition was. And he said, like, because of the itching.
So this was 3 p.m. Friday.
Yeah, around so. So because of the itching, he actually thought, like, yeah, like, I think you have the condition, and we need to get you induced right away. He gave us the pros and cons, and basically he said, so this was the Friday, so he said by Saturday or Sunday your baby boy will be here. You would have to get induced, but sometimes your body doesn't cooperate. So if worse comes to worse, I would have to get a C-section. So it's either my body cooperates with the whole inducing, and if not, I would have to have a C-section, which we were really hoping not to do, because no one wants to have a C-section.
But we were willing to do it, right? Because it was better safe than sorry if she had the condition. So
yes.
Yeah. So that happened. We went back home.
No, well, they induced me. Remember? So they induced me with a thing called Cervidil. It's like a little paper with a string that they stick up my cervix, like underneath my cervix, which hurts like hell. I was monitored for 2 hours, and then they sent us back home. So
we went back home and chilled until she started getting contractions at 12 a.m. Really hard contractions back to back. We're like, okay, this is it. The baby's coming soon, and yeah. So we waited a bit, so they wouldn't send us back home. Got to the hospital around 2 a.m. We got there, and they hooked you up. They checked the monitor and everything.
Yeah, well, the first thing, so they hooked me up to check the monitor, like the heartbeat of the baby, and to see my contractions. And they said, yeah, like, you are having contractions. His heartbeat was fantastic. And they, after that, the whole hookup situation, they checked to see if my cervix dilated. So let me explain to you that whole situation, because I felt like I was gonna just backhand the nurses. So what they do is they stick their fingers or their hands up your vajayjay, and they feel around to see if your cervix is opening. But like, I can't even explain to you the pain. Like, it was so painful. Like, so anyways, that happened. I wasn't dilated at all. My cervix was still, so after all those contractions, my cervix was still completely shut. I guess my cervic walls were still thick. Nothing, so like internally nothing happened, but I was having severe contractions, but that was because of the Cervidil, like, because it's a medication on the paper that they stick up. So what happened after that?
So nothing happened. They sent us to walk for an hour to see if that would make more contractions more severe and open their cervix. So we came back after an hour, nothing. Same, the cervix dilated like maybe half a centimeter.
That was just like, oh, well, yeah, you dilated 0.5 centimeters. And I'm like, oh, that's fantastic, just 0.5, okay.
Yeah, cool. So nothing happened, so they made us wait so they made us still wait, but she was still getting bad contractions and severe pain, so they gave her some morphine.
Morphine, yeah, to settle the contractions, which works beautifully because I slept through all my contractions. We were actually, because it was Alex.
At 7 a.m. they give you morphine, right? So around 7 a.m. So we've been there for like 5 hours, 6 hours practically.
Yeah, and I felt so bad because my mom and Alex were there. They looked so tired, and through the contractions, they're both like, breathe.
I felt bad for her because they kept doing cervix to check her dilation like 6 times.
6 times.
And each time was so painful, yeah.
I actually cried at one point because I'm like, I had to like scream stop. It was so terrible. So after the morphine, I slept. We actually all got to sleep finally for like a few hours. I woke up. They checked again to see if it dilated, and it didn't dilate at all. They said, oh, but actually my cervix thinned out a little bit, but my actual opening wasn't open. So they decided to do another Cervidil. So once you do another Cervidil, they monitor you for 2 hours.
At like around 2 p.m. So this is around 2 p.m. They give her another Cervidil, and they monitor you for 2 hours. Yeah, see, they were trying to see if it would open again. Nothing happened, so they sent us home at 4 p.m. They're like, you know what, guys, just come back when you get contractions like the last time. So that was annoying because we go there and we didn't want to leave.
Yeah, no.
But like,
we really
okay, so we're then like, okay, we'll go to Fairview Mall, which is a mall just down the street from the hospital we were at. And we're like, okay, we're going to walk this out and it's going to happen right away. Wrong. Nothing happened. Destiny was feeling super tired.
Yeah, and I wasn't feeling contractions, but
no contractions.
Yeah, at all. I was so tired because of the morphine, but like in terms of contractions, like I would feel like here and there, but not as intense as the first Cervidil. But I was really, really tired, so we decided to
go home and take a shower and stuff.
Yeah.
So we get home, we take a shower, and Destiny notices, oh, the Cervidil is anymore. Like if any the moms in here watching, they could know the Cervidil hanging out. It's like a long shoestring, and it's not there. So you're like, oh, we got this little paper telling us what to do, and it says if it deattaches or anything, come back home, come back to the hospital. I mean, and we're like, we don't want to go again. We just wanted to rest. We just been there, so like, okay, we'll go and get it reattached. So we go back, and around 7 p.m. to the hospital. So we only got like a 3-hour break from the hospital, and it was just driving mostly. They took more blood work from her. Everything came back good, everything. But all of a sudden, the resident came in and said, like, oh, we did the blood work for the cholestasis, and then you don't have it, so we think you don't have it, so you should just stop all this process and then just wait until he naturally comes next week. And we're like,
yeah, because it was
what?
like
The whole point of all this, the pain that she went through, I felt
torture. It felt like
was
torture.
to be safe because the cholestasis blood test takes 5 days.
Yeah.
So we're like, what the hell is going on? We could have avoided all this, or you're sending us back home with the chance that she still has it.
So literally, like the first result, like my doctor's like, no, like you have to get induced. We don't get the results back within a week, and you're due next week, so it'll be too late. Like you have to get this done. It's better to get this done. So it went from 7 weeks to them.
7 days.
Sorry, so it went from them saying 7 days
to
a few hours. So we're like, how did you get? If you guys were able to get this information within 30 minutes. How the heck are you telling us from before it takes 7? Like, so basically I went through all that for basically nothing because
that's what we're thinking.
That's what we thought, because that's how she explained
the resident was kind of flustered, I think, because it was her whole family, or like 5 of us in the room, and I was like questioning her super hard. I'm like, it's like
we had the whole crew in the room.
So I think she got flustered and like didn't explain it right. Yeah, was a little nervous, and then she just left. So anyways, an hour goes by, and the doctor comes in, like the main doctor. He's like experienced, like older, but he was really nice.
Yes.
Shout out to the doctor.
If you're watching this, you're amazing, doctor.
So he comes in and explains that he's like, no, we're not testing for the actual cholestasis. We're just comparing your blood work and seeing that it looks healthy, and we can't be 100% sure. But given like my experience with all these patients I've had in the past, he said that the itching gets better, but the itching gets worse, but her itching was less and less. So he's like, you know what, we think you don't have it. Your blood work, from what we can tell, everything's perfect. The baby's heartbeat is really healthy and healthy and a lot. And usually with cholestasis, there's a drop in heartbeat, which causes a stillbirth, but there's no drop. It was always up and consistent. So he explained it really well, and we're like, okay, you know what? I think it's the best choice to just go back home and let him come whenever he wants, because clearly he's being stubborn.
Oh my gosh, he was not ready, and that's the funny thing, because every time they would do every time they would do the cervix check, he would push himself to the right side of my stomach, so he's like, don't touch me, like, what are you guys doing? I'm not ready to come out. So he gave us the option. It's like we pushed the inducing, so that I would have, the next step was to do the drips.
Which even hurts way more than the Cervidil, which it stripped the cell membrane of her uterus. I don't know what to explain, but it sounds so painful.
Yeah, so that was that option, or to do a C-section. And he's like, your body's not ready, your baby's not ready. Like, I personally think you guys should just wait. And we're like, yeah, like if we don't... The whole purpose was that we were scared that it would harm our son. And the fact that it wasn't going to, we're just like, yeah, of course we want him to come naturally. So we decided to stop all inducing because I didn't want to go through pain, and if he doesn't have to come out now, why pressure him? So yeah, we decided to just stop everything and let him come naturally. And so another thing he said was that to be on the safe side, because my mom was worried that if I go home, what if his heartbeat drops? Like, how are we supposed to monitor his heart rate and whatever. So the doctor said we can come in every single day until, because he's due next week Thursday, so I'm literally like 4 or 5 days for my due date. So he said to be on the safe side, to come in every day, check his heartbeat, to see how everything's going, check my blood pressure up until his due date. And we're like, yeah, that sounds good. We live not too far from the hospital.
Yeah.
So today, after all of that crap, today, which is the Sunday, we went in, checked my blood pressure. They said everything was perfect. They said that my blood pressure was even better than it was yesterday. His heartbeat was perfect. He's responding really well. The movements are great. So yeah, they have no reason to think that I should continue inducing. They checked my cervix again. I thought I was going to get a break from that, but they checked it. The doctor said my cervix has thinned out, which is fantastic, and it dropped. So they think he's actually going to come within this week, hopefully his due date before Christmas. But yeah, so everything went well. The bright side is that this whole thing pushed my body to actually start to dilate.
So
that
it's a
was
little more
the good
dilated,
thing.
like 2 centimeters now, so that's good.
Exactly, because I went from 0 to 2 centimeters, so that's perfect, and hopefully
It's quite the experience, but we just want him to be healthy, so that's a good thing. Everything seems to be well. It was just a scare, a misunderstanding.
A huge scare, but
yeah.
I'm just happy that he's going to be healthy. But I have to go through that whole process again, guys. I went through like a false labor, and I have to go through it again. So I have to mentally prepare myself for that again.
But yeah, so
it
that's
was
it.
Worth it, yes. And if you have any experiences with the cholestasis, comment down below. Let us know how you dealt with it, or if you had to get induced, or like how your situation was, and hopefully it wasn't as painful as mine.
Don't forget to like, subscribe, comment.
Yes.
Yeah, and we'll see you next video. Adios.
Adios. Bye.